and this is the third week in a row that the county has decreases in the case rates. And these declines can be a result of the masking requirements and the small increases in vaccination rate. But we still need to take precautions because the Delta variant is still prevalent. And this is around the same time that we saw decreases last year before the winter surge. And the holidays are coming up. So just to be careful. And the LA County has modified their health officer order, adding vaccination verification requirements at certain high-risk settings, such as indoor portions of bars, wineries, breweries, nightclubs, and lounges. And then another update is that the LAUSD has made it mandatory for all students 12 years old and older to be fully vaccinated against COVID-19 by January 10th of 2022, unless they have a medical or other exception. And this is just an effort to keep schools open and simplify the vaccine access for those teens that are eligible but are still unvaccinated. And then you can now track the proportion of school age residents who are vaccinated by school district. And you would just go to our Vaccinate LA County website to view the data. On a happier note, LA County has also rolled out their free snack program where children and youth 18 and under can receive free nutritious snacks. And it includes vegetables, fruits, and some healthy dairy products. And there's about, I believe, 48 locations. And then I'll put that in the chat where those locations are, what website to go to. But that's all the updates.
Wonderful, wonderful. Thank you so much for that. I would like to have all of you put your chat, especially if you're a presenter, put your information in the chat, put a way to contact, people can contact you, and also for everyone so that we can kind of get to know each other. I am going to turn my phone off. And I'm going to turn it over to Jean. Jean Galliana, I am going to let you say who you are and what you're doing, and you're sort of leading this whole conversation. So Jean, please take it.
Thank you so much, Darcy. We're really excited. We've got we could have had 100 presenters, but we've got 5 really exciting presenters. We're going to talk about resources for older adults, ones that are available now for you to help support older adults who are at risk of or currently experiencing homelessness. I think I'll just call our first presenter out. If you're ready, Aiko, would you like to talk about your services that you're providing to our homeless population from Scan Health Plan and Independence at Home?
Sure. I thought I was number 4 on the docket. So
would you like to be 4?
No,
okay.
that's fine. I'm like, I was following your agenda because I don't know this group.
So, as usual, I'm off-roading. We'll go to
I
Shawn
was being
next.
very obedient, but yeah. So you know what? Let me get to the sharing screen part of
okay.
Zoom.
And while Aiko's doing that, each presenter could present for 45 minutes. But each presenter has 10 minutes today. So what you'll be receiving is a really brief summary of what they're doing. You'll have their contact information about their programs, and you can reach out to them for further information. Aiko, would you rather I share my screen? Or you guys?
It says host disabled participant screen sharing, by the way.
No, I just made you.
Oh.
I made you a co-host.
Yay, here I am.
There you are. All right.
There we are.
It just took a minute.
Yeah, can you all see this?
Yes, we can. Thanks, Aiko.
Okay, so the thing I gave you yesterday, Jean, is a little different from the thing I'm going to show you today because I moved things around because I didn't want to take too much of everyone's time because I know that, there's a lot of great speakers and I want to listen as well. So here's my new thing, and I'll be very brief, but I'll leave you all this slide so you can have the full 15 slides of this if you all want to have references. But anyway, so just give you that. So hi, everybody. Good morning. My name is Aiko Tan. I am the Director of Homeless Strategy at SCAN Health Plan, and I wanted to present to you our new homeless program. A little background about me and SCAN today, but I just joined SCAN Health Plan about mid-July. And so relatively new to SCAN. I'm charged to launch homeless initiatives for the health plan. And we're going to be presenting that to you today. But I'll give you a quick, really quick overview of SCAN if you don't know who we are. I work on Independence at Home. It's the community benefit of SCAN. And community Independence at Home is the part of SCAN that is for the community. It's community facing. It's not the big health plan that people usually know about. But SCAN has actually, we are an old organization. We started in Long Beach with 12 angry seniors, and we are mired in social services. We started as a social service program because there were seniors that needed and demanded better service for them. And so they created SCAN, which stands for Senior Care Action Network. And the Independence at Home is the arm of SCAN that still follows that social service roots. So we are really into ensuring that we not only do health, but we also do all the social determinants of health. So knowing that, I sit in the Independence at Home side of SCAN, and we'll get to that. But we provide long-term supported services. All our services are free. So just wanted to know that, we do not charge for anything. This is a benefit that SCAN has. We're getting paid by the big SCAN health plan, and we provide all our services for free to the community at large. We focus only on seniors because that's who we are, but not the 65. We are 55 plus, and also their caregivers. So know that all services for caregivers are free as well, right? So that's who we are. The IEH team is very robust. We've been doing this for 30 years, and we have a lot of different programs on our side of SCAN. We have a community education, a virtual senior center, because now everything has to be virtual. We have Insights, which is our short-term behavioral health therapy. We have Coach, short-term case management. CMEDS is our medication safety program for seniors. And we have a contract called MSSP that's a little more intense, and that probably take a whole another half an hour to talk about, but I think we have an MSSP provider here that's going to speak, so I'll just touch about that. What we do as MSSP as well, and these are all the programs that we have serving Los Angeles County. So know that I'm part of this world, and all these options I can leverage for the clients that I serve for the homeless program. So what's the eligibility for us? 55 plus, so not just seniors, but older adults. Caregivers of people 55 plus and older. There's no income requirement. All services are free. There's nothing that we charge. And we are starting the homeless program in Los Angeles, even though the community benefit extends to 3 counties in Southern California. Okay, so that's kind of who we serve. It's a big catchment. I'm in charge of creating a homeless service program to not only take care of seniors in experiencing homelessness, but also older adults. So this is my charge, and this is what we're going to be launching very soon. We're actually working on a few cases right now with some of the homeless service providers. So I wanted to show you what we do. But to go back a little bit higher, I just wanted to mention again, there is a lot of parts of SCAN, and I wanted to kind of give you an ID. So SCAN Health Plan is the big mothership. That's who everybody knows. We've been doing it for 44 years. And then here is Independence at Home, which is the community benefit arm. This is the arm that is the flexible part. This is the community part. This is the social services part. This is the free service part. And we will love to provide, care management to anybody that needs help, that is a senior 55 plus and their caregivers. And we're going to focus on Orange County right now. This program is pretty malleable because we just started it. So I've been sitting in a lot of meetings. I know you've probably seen my face in all the SPA meetings, but I really wanted to do some active listening and hear what the unmet needs are for the service provider community, and really help you guys, maybe navigate the healthcare system or provide, some services that you're keeping you up at night. So that's that. And then we're opening a new medical group. The SCAN is going to create something called Healthcare in Action. This is a medical outreach team. They are a full full-fledged medical outreach group. They're going to start in January. It's going to be very exciting. They're going to have medical vans, and they're going to go to the encampments and start serving seniors in the encampments and under, wherever they are, and work with the seniors out there in the field and hopefully get them better service in terms of their healthcare needs. So that's launching in January. So as you can see, we're trying to create a big catchment area. We want to provide for our members. We want to provide for members that are not SCAN members, and we want to provide in housing, in health, in the streets, and at their homes. So we're trying to create a little bit of a safety net within SCAN, and we just wanted to show you that it'll be fully fledged probably next year, but we're embarking with it now. Okay, so for our target population, again, just a quick rundown. You'll have this in the slide when they send it to you. So 55 plus, at risk, needs assistant. And we're going to be very, very malleable about what you guys need. After sitting in 70 different, service provider meetings, there's a lot of recurring themes that we've been hearing. But case managers are talking to us, service providers are talking to us. So what can we provide? Let's be concrete now, right? So this kind of gives you an idea of what we can do. And this is coming from all those meetings we've had. So does your client need a walker or a wheelchair or any durable medical equipment, O2 tanks, hygiene supplies, maybe an ostomy bag? Yeah, we can help because we are a health plan. We know how to navigate. And if the client is an LA Care member or an Ultimate member or Blue Shield Anthem or anything like that, then we can help you guys navigate that kind of complex healthcare system and make sure that you're not leaving any of these resources on the table. So you can allow us to do that, and we'll give them a call. And if it takes too long, we will just provide it. So just know that, we have a little backup plan. Does your client need help taking medications? They might have their pharmaceuticals, but they don't really know how to take it or what drug interaction is. We can help because we have our medication safety program. So we can bring CMEDs onto that. Does your client need deep cleaning to maintain their housing? This is a thing that everyone's asking me. It's a risk to their housing. So yeah, we can provide 1 time or 2 times deep cleaning so that it'll clean up that area and allow the landlord to be a little bit not so difficult when your clients are getting their inspection. So yeah, we can help with that. So no worries. Does your client feel isolated, need a socialization? I think we all feel this. So we are really looking at SCAN to help to kind of cover the digital divide. And so we are being very proactive in providing a lot of contacts with our virtual senior center on online community. And we will provide iPads and Google Home devices if they need to. And that'll help also if they would like to do their virtual medication safety. So yes, we are looking at that. We will also do training for all seniors to work with that IT or their caregivers. So yes, we would love to be able to see how this works out. Does your client need help with transportation to his healthcare appointments? This is a big one. Everyone does. I'm just going to say, and health plans should be providing this, though it's very difficult to navigate through the health plans. And we know that, and we know you're busy taking care of your clients and their immediate needs with housing. So let us do that. We can come on board, help you navigate this, and we'll probably make the calls for you and get those transportation needs. And if not, then we have access to vouchers and access. So we can do that as a backup. So know that. We would love to be able to connect them all to long-term because that is more sustainable. But in the short term, if they do need to go to dialysis tomorrow or their cardiologist, we will just get a taxi voucher in front of you. So don't worry about that. And does your client have mild to moderate depression? We do have something called Insights. It's our therapy. And so if your client's all right with having a virtual device and using that, or service providers would like to have an iPad in their desk and give it to their clients to access their maybe their therapy or the virtual senior center or their medication safety, we will provide you with an iPad and you can just keep it in your locker or your desk and then have it go out to your clients when they need that. So we're trying to make this very easy and accessible for all seniors to access our services. So this is a little bit concrete. So I wanted to just kind of answer the big FAQ questions that I always get. And the way we're looking at our program strategy is that, we're hearing a lot of quick engagements. So we know that that'll take 1 to 3 months, maybe just get people signed up to Medicare, Medi-Cal, get their insurance up, connect them to services. We can do that. And so if that's all you need for your client, that's all you need for your client, and we're good with that. If you need a little more help, then, we can help with a tier 2, maybe, be with your clients for 6 to 12 months. We would actually like to not be the primary case manager. We'd rather help you out because you already know the client. You already know what they need. You know what keeps you up at night. So maybe we can just come in and help you with those gaps in services that kind of mystify you and keep and we can help you out and get going. So we really want to help as many clients as we can. And we know that, by doing some kind of, shotgun approach really helps case managers. But if you do need a little more with ADLs and they're more medically fragile, we can come on board and really walk hand in hand with you with their healthcare needs. So we are not housing, we're a SCAN health plan. So our expertise is not housing vouchers or subsidized. So this is not our expertise right now. We are really health plans. So please let us do what we're doing well now as we learn how to do housing, but we really rely on the case managers to do that heavy lift. We'll do the other heavy lift. So that's kind of how we're hoping to, to support the safety net. And if you do need someone long-term, they're in the street, they're hard to find, they're high risk, they might have medical needs, we can get our medical van from the health group to go out there and start making connections and see how we can get them into housing. So this is a long-term approach, but right now we're hoping to be able to serve a lot of people with the tier 1 models. Just, let us know what you need and we'll just come on board and get it done. Tailored support, this is everybody's client-centered approach. So look, we really want to provide gap support of a care plan if it already establishes. So if you've got a client and you've already got a care plan, you just need that one thing or those 3 things, with a health focus, we'll come on board and help you out. And then if you need us, we can kind of continue on. But that's kind of where I see our immediate need and immediate help right now that we can do. I kind of ran through this very quickly. You will have all these slides and the referral form, so do not worry. But do anybody have any questions that I can answer? And I also have here in the audience my care manager, Elias. So
Darcy, due to time, should we hold questions till the end or do questions in the chat so we have time for our next 4, or what do you think?
Well, I see one question about maybe Aiko could address, and please do put questions in the chat and we'll go back and get those at the end. Aiko, do you guys address hoarding?
You know what? Hoarding is a recurring theme issue, and hoarding is a behavioral thing. And we are starting to look at hoarding. I think everyone's scared to tackle hoarding, but we are planning on doing a lot of research on hoarding to see how we can help address it. Right now, we're not there yet, but it is on my radar to really dig deep, because I think what SCAN can do, because we have a lot of subject matter expertise in seniors, and we want to do this for the long run. We need to tackle the big issues that everybody needs. IHSS, how do we make that better for you? And how do we get that accessible? And workforce, because we need to scale. We have a lot of a need. We have money coming in, but we don't have a lot of, workers. So how do we do training and education and also hoarding? So those are the big 3 that are in my future. And don't worry, I will be looking into tackling all 3. But right now we can do some help now while I figure out how to do the big 3. So hopefully that kind of answers your question.
Thank you so much, Aiko. And you may find some more questions for you in the chat, you and your team. And
Yes.
Everyone should know that they'll be receiving a copy of this presentation, and Aiko's contact information is also in the chat. So start thinking of how your case managers or yourselves can engage with them to help fill gaps or needs that you have in serving your older adult population.
Mm-hmm. Okay.
So next up, we have Shawn Callahan. She's going to talk about health homes and their work at Partners in Care around that. Shawn, will you be sharing your screen or should I share it for you?
I can share my screen if that's
wonderful.
Works.
That'd be perfect. And we'll be hearing about MSSP next. So heads up.
Okay, just made you a co-host.
Perfect. Thank you. see, last time I did this, I got kicked out of a meeting one time, so I hope I don't happens again. Let's see if I got this. Okay, so I'm going to be presenting on a brief overview about Health Homes program here at Partners in Care, the social determinants innovators. This is our mission-driven statement. Partners shapes the evolving health system by developing and spreading high-value models of community-based care and self-management. So just to jump right into it, HHP, also Health Homes program, has 6 core services. That's comprehensive care management, care coordination about physical, behavioral health, and community-based long-term services, health promotion, comprehensive transitional care, individual and family support, and referrals to community and social support services, including housing. What we really like to do is we like to do a health risk assessment with our members, and through that we come up with goals that the member wants to work on. So if they mention something that they are struggling with their diabetes, we'll make a diabetes goal so that they get the education they need and work with their doctors on how to improve their life with diabetes as well. And without the doctors, even if they want to do something outside the home, something along the lines of getting involved in more with the community or just learning how to exercise, we help them navigate the services in LA County to find which ones best fit them. So that's an overview of some of the things we do here at HHP. And we serve all of the spas 1 through 8. We have care coordinators living in the same communities that our members are in. That way, you know, in the beginning of HHP, we did do in-person visits. Unfortunately, with the pandemic, those have been suspended unless on a very serious need basis. For example, we do have a member who doesn't know how to read. So on some cases, we do go out to him in order to help him understand his mail. He was going through an eviction at the time, so we had to help him understand some of the information he received about it. He did remain housed, luckily. I'm very happy for him. Most of our members do tend to be in spas 2, 4, and 6, as long as most of our homeless members do tend to be in there. And we also have HHP in other areas like Inland Empire and San Diego as well. We work with 5 health plans: Anthem, LA Care, Blue Shield, HealthNet, and Molina. We are contracted with them to serve their members. A lot of times that's how we can get referrals. That's how most of our referrals come in, is directly through the health plan. So for eligibility purposes, if you wanted to refer to HHP at Partners in Care, they would have to have one of these health plans. So who our members are. So this is just a graph to show the age range of our members. We serve anyone from, you know, age 0 to up to, there's no limit. I think we had some people almost hitting 100 at one point. As you can see, most of our members do fall in the 55 to 65 range, and most of the conditions that we do see are in relation to diabetes, hypertension, congestive heart failure, COPD, asthma, and depression as well. And people experiencing homelessness. Our members, when I did this at first, I was shocked to see the complete almost 50-50 between at-risk and homeless in our system, and a little small on the chronically homeless side. Most of our members who are experiencing some housing instability have an average age of 50. So again, close to that older adult range. And how we help our members with homelessness is with HHP, we're very lucky to have a lot of out of the box thinking, a lot of problem solving. We will do anything we can to get to the right resources until we're told, okay, you stepped too far. Not within your scope of work, but we will do what we have to. We love working with housing agencies, whether that be directly with the agency or with the case manager already assigned to a member, in order just to provide that member full on care and support and work together to fill out applications. Especially with housing agencies, sometimes it's easier for them to help with documents than it is for us, since right now we can't do in-person services. So it's a good partnership. We also have access to HMAS, which we utilize for coordination and connection to resources as well. An overview of enrollment or referrals. Like I said, the health plans usually refer. We can also have outside agencies refer. We'll provide the referral document. And even sometimes within partners, we do direct referrals ourselves. So if we have a member talking to us and saying, oh, my mom's getting worse or something like that, or my mom's diabetes is out of control, we have been like, oh, let's get your mom in the program as well, and done a direct referral and had family members in the program together. We have actually 2 sisters in the program under the same care coordinator, working together on housing and health, which is really cool. With the intake, you know, we do an eligibility screening. It's based on conditions and acuity, and we want to make sure there's no duplicative programs, since we do get paid through the health plans. They can't be in 2 programs at once, like a skilled nursing facility, hospice care, or whole person care. So this is just a screenshot of the first page of the direct referral form, just so you guys can see it. Along with the form, when submitting for a direct referral, we also ask that it includes some type of discharge summary or clinical note that validates the criteria being met. There's some instances where we enroll people based on a current criteria, but that diagnosis doesn't actually exist, and then they have to get disenrolled, and it's just heartbreaking that way. So we do ask for official documentation just so we can avoid that situation. This is an overview of the referral process. Our hospital navigator, Alexandria, actually handles all direct referrals. I listed her email below as well. You would submit the referral to her, she'll review it to make sure all information is there. She'll send it to the health plan, wait for them to approve, and then she'll do the outreach if it is approved, and then the member gets enrolled, assign a care coordinator, and then case management can begin. And that is Partners in Care. On this page, I have included Alejandra's information and my information as well. If you would like to reach out with any questions or direct referrals or partnerships, anything at all, please feel free to reach me.
Thank you so much, Shawn. That was amazing. It's such a great resource. I am constantly sending out this resource to people who write me with issues, and Partners in Care is so responsive and just really incredible. If anyone has any questions, maybe you could pop them into the chat, and if we have time at the end, we'll take questions. We just want to make sure all our presenters have time. So up next is Sal Perez. Sal, are you prepared to present now?
Yes, I am. How's everyone doing today?
Would you like to share your screen, or would you like me to share the document that you sent?
If you could share it, please, that would be great. Thank you.
Okay, and next up after Sal, just so everybody's ready, is Dr. Haida and Catherine Crane from DMH. Lastly, we'll wrap it up with Alexandria from LAHSA.
So I'll try to be as brief as possible. Alois Raquel, who's the director over the North Office, which handles San Fernando Valley, as well as our Los Angeles site that covers LA County, anywhere from downtown Los Angeles, Koreatown, on down to Long Beach, Linwood, and everywhere in between, Inglewood, South Los Angeles. I've actually been with Partners in Care for about 10 years. I started as a care manager myself, and then I was a supervisor at the Los Angeles site. So I know that site very well. And now I'm the director for our Santa Barbara and Kern County site. So if you happen to have any referrals on that way, we happy to welcome them. As Aiko was mentioning, MSSP has been around for 40 plus years. It is a long-term support service program. We've had clients that we enrolled yesterday that we're going to enroll today that have been with Partners in Care for 15, 20 years, and some even more. We're funded through the California Department of Aging and federal medical funds. The Multipurpose Senior Service Program, MSSP, enables seniors to age in place by delaying or avoiding entirely inappropriate and costly nursing home placement through the provisions of long-term support services and supports necessary for independent living. We work to empower and encourage independent living by providing the following services: adult daycare support center, minor home repairs, chore, personal care assistance, protective supervision, care management, respite, transportation, meal service, and communication services, including translation, interpretive services, and the provision of the emergency response system. Such services are coordinated with our contracted vendors and local community services, LAHSA, Meals on Wheels, CBAS, Access, etc. Participants 65 plus who are qualified for the Medi-Cal and functionally impaired or have a medical condition that makes it difficult to complete everyday activities may be eligible for MSSP. Once qualified for MSSP, all services provided for the program are completely free. I did include our intake coordinator, Maria Carolina. She goes by Carolina, but her email is Maria May, and she's our program and project coordinator with her phone number and her email if you do have any referrals. Again, we provide an array of services. I think Aiko mentioned too, transportation. It is very difficult. We do try to coordinate with the care plans that Shawn had included, Molina, LA Care, Kaiser, Blue Cross, HealthNet, and so forth. We do have a few clients that are fee for service, so we can work with them as well. In terms of transportation, we do try to go through the health plans or community services resources first, like Access. However, if that does not work out for them, we do have vendors that we contract with that can provide transportation to and from medical appointments as well. The same with Meals on Wheels. Sometimes there might be a wait list for Meals on Wheels. If we can't find a location that offers Meals on Wheels in a client's area, then we can provide supplemental meals as well. We don't specialize in housing. However, being a care manager myself, I know that sometimes we go an extra mile and we see if we can find housing once they're enrolled into the program. They do have to be actually living at a residence where we can make contact with them. Right now, it's a little bit easier because a lot of the care managers are working remotely and don't necessarily need to go into the home, but once we go back into the home, they're definitely gonna have to, but that is one of the requirements. They have to be living at a residence. There has been times though that maybe we got a referral from APS and they connected them with a housing voucher. They referred them to MSSP. They were enrolled. We referred them to, for instance, the Salvation Army housing program, got them another voucher. And sometimes we're able to connect them with housing, but if we can't, we can keep them in the program temporarily. But if we're not able to find housing, then we may have to terminate them. But in between, we're going to try to help them as much as we can with as much services as we can. And that's it. Thank you.
Well, thank you so much. This is such an interesting program. And I know that Aiko said they also have it in Independence at Home. So if people want to submit their client for this program, do they have to have a certain health plan, or do they only just have to be 65 plus and qualified for Medi-Cal?
65 plus.
Okay, and so they just reach out to you directly and you send them.
And Sal, you have to confirm this, but my understanding is that there are several MSSP providers in LA County, and we all have a geographical reach. So depending upon where your client is and what housing, where they are in terms of their housing, will determine which MSSP program can help. That's so I know it's a little bit of a carve out. So you let me know if I'm wrong, Sal.
Well, that is correct. There are several MSSP sites. We have Huntington Senior Care Network in Pasadena. We have SCAN, Aiko mentioned, Jewish Family Services. And so a lot of the different MSSP sites, they kind of overlap. And so if we get an intake that we see that it's more closer to where SCAN services, then we'll connect with SCAN and make sure they get that referral. Or if it's closer to the Pasadena area or San Gabriel area, we may refer them to Huntington Senior Care Network or Human Services Association. So we're all in kind of connection with one another. Yeah, and in terms of making sure the client get their the correct services and the correct catchment areas.
Right.
There
And
was
it's
a
a
quick
state.
question about, is chronic illness required for eligibility?
They should have at least 2 or more diagnoses. But yes, the clients that we service at MSSP are some of the most frail clients in the community. So a lot of our clients do have, perhaps maybe they might have hypertension, arthritis, diabetes, that pretty much qualifies them for sure, or Alzheimer's, dementia, and so forth. It all depends on their activities, their functional activities of living, whether they can complete them independently. Now, if they can complete all of them independently as we're assessing them, then we may not be able to bring them into our program. We may refer them to another program like linkages, or a program that may not have such strict requirements as MSSP does. But for the most part, most of the clients do qualify.
Okay, thank you for that. And just a reminder, please put your contact information, everyone that's here, into the chat so that, we can get information out to you also. And Jean, if you've got all of the documents, can you upload them in the chat also? They will also go out in our follow-up email.
Yep, I'll work on that. While Dr. Haida and Catherine Crane talk to us about their programs at the Department of Mental Health that serve older adults. And I believe they will need permission to share their screen.
Thank you. Good morning, everyone. I'm Dr. Haida Fakhrobadi, clinical psychologist with Los Angeles County Department of Mental Health. It's a pleasure and honor to have this opportunity this morning. And Ms. Catherine Crane, my supervisor, our program manager for Genesis program, she's joined via telephone. I don't know, Ms. Catherine Crane, can you hear me? She's joined via phone. I think if on the phone, how can unmute themselves? Is that star?
I'm not sure.
You know what? I can't remember either.
Hello, everyone. It's Catherine. Can you hear me?
All right.
Oh.
There, yes.
Hear you.
Yes, I had a little voice in the background say, Catherine, it's *6. So anyway, I'm happy to be here. I'm sorry about my technical difficulties this morning, but I am the program manager for the Older Adult Genesis program. I'm an LCSW by trade, and I am happy to be here with Dr. Haida.
Wonderful.
All right, can you guys see my screen? I'm going to share it, presenter mode.
Yep, looks beautiful. Thank you.
Awesome, great. So this is our Los Angeles County Department of Mental Health mission statement. We promise our community that we're going to provide a quality care to LA County residents. As you all know, Los Angeles County, it's huge. Over 10 million individuals live in our LA County, and Los Angeles County Department of Mental Health is the largest department of mental health in the nation. And we provide mental health services through our directly operated clinics from the Department of Mental Health. And we also have many providers that we contract with, and we provide services. We provide all mental health services: assessment, case management, crisis intervention, medication support, peer support, and other rehab services. We serve all LA County. As you all know, again, LA County is huge, over 4,000 square miles. I don't know if you guys know or not, but Catalina Island is part of LA County. So we are divided into service areas. Our service area 1 is Antelope Valley. Service area 2, San Fernando Valley. Service area 3, San Gabriel Valley. Service area 4, Metro Los Angeles. And service area 5, I think it's the West Side Coalition. It's service area 5. And service area 6, South Los Angeles. Service area 7, East Los Angeles. And service area 8, South Bay Area, which, as I mentioned, Catalina Island is part of that as well. I've been to all the service areas and all 88 cities of LA County. I've never been to Catalina Islands, but it is part of LA County. And anytime I have opportunity, I let the audience know. You never know. Maybe we get invitation to Catalina Island to make a presentation as well. So our Genesis program is a interdisciplinary team. It's field-based. We provide assessment, medication support, therapy, individual and group. And I'm proud to say that we have started several support groups for our older adults that we're serving in LA County, and we utilize virtual HIPAA compliant platform. And we're getting more and more requests to have these groups, as you all know, because of coronavirus COVID-19. If older adults were isolated prior to this pandemic, because of the pandemic, and it's understandable because of the health and safety concerns, they're more isolated now. So throughout these groups, we're providing more resources and services to our clients and also our community. But all of our clinics are open. We follow all health and safety protocols, and we do triage. And if it's needed, we see individuals face to face, again, with following all health and safety protocols. We provide case management, linkage and referral, consultation, and we utilize evidence-based and promising practices when we providing services. And also when we provide mental health services to our older adult, we do screening for cognitive assessment. So we utilize evidence-based screening tools such as MMSC or Montreal Cognitive Assessment, MOCA. We provide 100% field-based through our Genesis program. We conduct mental health assessment and screening, as I mentioned. Our nurses do head-to-toe nursing assessments. We have a lot of community collaboration, advocacy, linkage and referral, psychotherapy, medication support. And as you all know, we are specialized in providing training and also resources and services on hoarding disorders. And we have hoarding disorder, we have hoarding task force, and we are in the process of starting up the program again and our meetings, and we will reach out to all of you to join us for that task force. And as I mentioned, we provide all kinds of services. The Genesis program is a very innovative program, and we provided telepsychiatry prior to coronavirus COVID-19. And we have a variety of co-location program at senior centers and also senior housing. We provide mental health services wherever our older adults find it conducive. We know that for a variety of reasons, people may not want to be seen at mental health clinics. So that's why we go where they need us. We have co-location at health clinic, our violence intervention prevention VIP clinic. We're a core member of Los Angeles County Elder Abuse Forensic Center. And our team consists of a social worker and social work interns. We have registered nurse, case manager, psychiatrist, psychiatric residents in geriatric psychiatry, geriatric medicine fellow, nurse practitioner, health navigators, and service extenders. And our services, as I mentioned, is designed to address the unique needs of our older adults who are 60 years and older, for older adults who may be have mobility issues, not able to access maybe transportation, may not want to be seen at a mental health clinic for a variety of reasons. As you all know, stigma related to mental health is huge. But I'm proud to say that with all the education we're providing out in the community, we see that people are reaching out for help, which is wonderful. And so basically it's for older adults 60 years and older who are unable to access services due to maybe impaired mobility, individual who may be vulnerable, frail, and have limitation. So this was a very, very abbreviated presentation of our Genesis program. If some of you know me, I like to talk. So I don't know why you guys didn't put me last, but I'm just gonna monitor the time, and I'm gonna give the floor to Ms. Catherine Crane if you want to add more to our Genesis program.
I do. Thank you, Dr. Haida. I'm always impressed when I listen to Dr. Haida talk about our program. Because she does such a great job. But I think one of the things that's very important for all of you to know is that, you know, with COVID, there has been a hiring freeze for the Department of Mental Health. That's being lifted, but we have a team for each service area that's assigned to each service area, but it's only one team. So, and as you can see, LA County is very large. So I think it's important for all of you to know that we are selective about who we can take as clients. So we serve the most vulnerable older adults, those who are often unable to get out of their homes. They have severe mobility issues. They're really not able to drive or get to a clinic. So oftentimes now, if someone is 72, I know our age criteria is 60 and above, but let's say someone's 72, male, has depression, but also is physically fit and drives. That is not someone we would take. That is someone we would want to refer to a clinic so that they can access services at an outpatient clinic and hopefully participate in groups that are available there. So we don't want to be biased about age. It's about functionality. And so I just want to really affirm that for all of you, because it is about the most critical, vulnerable older adults that we take, those that really generally need the support of a nursing assessment. So I just want to reiterate that. I think that's an important piece. Also, hoarding task force. Yes, I've been with Genesis for about maybe 4 months now, and we do want to reinstitute the hoarding task force. So we are taking names for people who'd like to be on that task force. We've got a very extensive history with hoarding as a program for the Department of Mental Health. Hoarding is our expertise. And we actually sponsored the Hoarding Forum for well over 10 years. So during COVID, in the last few years, that fell to the wayside, but we are going to be bringing the Hoarding Task Force back. And having said that, I know that SCAN is in the room, so I would love to partner with you on the Hoarding Task Force. There was about probably 7, 8 years ago, there was a hoarding task force that was stationed out of the Department of Mental Health headquarters in downtown LA, but also in Long Beach, we had a separate hoarding task force. So I would love to start that hoarding task force up again also. So any help that I can get, I appreciate a lot. I have an MSW intern this year that's going to be helping me along with Cindy Bosco. And of course, I have the wonderful Dr. Haida to help me. So that's definitely on our radar. We know hoarding is a very difficult disorder. And it's associated with people losing their housing and becoming homeless. So and there's a lot of denial in hoarding, the hoarding disorder. So we're here to support, we're here to tackle it. And yeah, any questions for me? Any thoughts about that?
I just want to mention really quickly, I put the Genesis telephone number, our 24 hours, 7 days a week telephone helpline from the Department of Mental Health, 1-800-854-7771, and also our contact for myself and Ms. Catherine Crane in the chat box. And also, just as a resource, after the coronavirus COVID-19 pandemic, our department added another resource for our community. It's our emotional support line. So if people call that 800 number, 854-7771 from 9 a.m. to 9 p.m., if they press 2, They'll be connected to our emotional support line, and various language capability is provided.
I'd also like to add to that. I think one of the things I'm so proud about this program is our passion for serving older adults. So please use us if you need to. We have our OACT consultation where we discuss difficult cases. Please reach out to us if you're interested in getting some consultation. I often will take a call just off the cuff. Someone will say, I've got this senior, what do you think? So we really do care about our older adults and have tremendous passion for collaborating with other agencies and being of service.
Oh, this is super exciting. Collaboration's already starting, and you guys hiring up. We know we need our system needs your support a lot, and it's thrilling to hear the hoarding task force is coming back. So this every one of these presentations is super exciting. I wonder if Alexandra Brown is up and ready to talk about the problem solving at LAHSA.
Yes. Hi, everyone. Good morning.
Hi, Alexandra.
Hello, hello. I think for the sake of time, I'll skip the visual presentation. I know we're short on time. So I'll just want to talk to you all. My name's Alexandra. I am the manager of problem solving at LAHSA. And I just want to say it was a real honor to hear all of the resources and passion that came before me. And so hopefully problem solving is something that will fit into all of your roles in different and unique ways. How many people here by a virtual raise of hand, or you can shout it out, has been frustrated with trying to make a referral into the homeless services system, or with seeing the lack of resources that exists within our homeless services system for the folks you're serving? Yes, I see some waving hands. Absolutely. Yes, as you all know, we have a crisis that is far larger than the amount of resources we have available. And so problem solving is something that we aim to implement for a couple of reasons. Problem solving is a very light touch intervention that really tries to focus on connecting folks back to their social support networks, tapping into their own resources, tapping into community resources that are out there to see how we can very quickly and creatively resolve the housing crisis. And it's a best practice and intervention that we're implementing throughout every single facet of the homeless services system. What we want to do, and what Jean will send you all later, is a flyer for a training. And this training is one that will give you all access, or whoever you would like from your team would gain access to problem solving assistance funds that we hold centralized at LAHSA. And these funds would do things to support you all in supporting your clients or the folks that you're serving in quickly resolving their housing crisis. So let's say there's someone who maybe they have income, but they can't afford that really expensive security deposit. Problem solving would be able to pay for that move-in assistance as long as they can sustain. I heard a lot about hoarding. So let's say someone is getting evicted because the landlord is frustrated with the hoarding situation. We've in the past paid for hoarding the cleanup. And obviously you all talked about how this is a behavioral issue, a mental health issue. So there is a lot to go along with it that problem solving, isn't there to be of support of, but problem solving would be able to pay for that hoarding cleanup to prevent that household from facing an eviction. And then I think that's where some of that partnership and collaboration can come along to connect that household to maybe some mental health resources or any other resources that may be able to make that situation sustainable. Let's say you're working with a household and they have come to LA and they, want to reunify with their family in the Philippines. That's happened, or Honduras, or they want to go back to Texas or Oklahoma or somewhere where they have friends or family. Problem solving would be able to pay for that support to help connect folks back to their friends and family or social support network. Problem solving is able to pay for security deposits out of state as long as the household is able to sustain. I'm being really funds heavy to just capture your attention, what you all would have access to. If let's say there's someone who has a utility assistance bill and they need support with that because they can't afford it and they're between rent and utility assistance, we can help support that. And also problem solving, once you take the training, you'll have access to a plethora of funds that you can use as negotiating tools to try and mediate a stay with friends and family. So the training to get the funds is something that I'm going to share with Jean, I think, and she'll be able to send it out to this group just because I don't have all your emails and I don't have access. You can take this training without access to HMIS. Our team is always going to be available to case consult with you, to talk about what's eligible, what's not eligible. We'd be more than happy to come to your agencies and present, have like a larger presentation for your teams. Just to give you some context in the system in general, right now we're seeing a lot of implementation and problem solving with individual adults and with with individual adults and with families. We're seeing our team needs to provide more support in the youth system and in the older adult system. So I'm really excited that Jean has invited me here to introduce problem solving to all of you. And if ever you want any data on what's going on, I know we have very limited data with older adults. However, we want to increase that, and we hope to increase that this fiscal year. So I think if you all would like to invite my team to come and present at one of your agencies, we'd be happy to do so. Jean will share out our flyer. And the training is 50 minutes long. It can be taken at the learner's own convenience. It is, I believe, helpful to take that training and then to invite us for something that's more in person, in depth, personal. We can talk out cases. We have seen some very successful cases with folks who are considered older adults. There was, I'll just share really briefly because I know we're at time. There was a situation where a constituent called a council district office because they were highly frustrated with the fact that there were two men experiencing homelessness on their street and they're elderly and there's no resources. And they weren't calling to complain about, in other ways, constituents may call and complain when they have the NIMBY mentality. They were calling out of concern. And so what happened is they ended up taking in one of the men who had been experiencing homelessness for 5 years. And while we waited, we were able to pay for a car repair to support that. And while we waited, while he was only there temporarily and then was matched to a more traditional housing resource. So even a temporary diversion is a huge success, and it really taps into the strengths of the community and the resources of the household. The other person was reconnected to a cousin up in Lancaster, and we were able to pay for security deposit for a room rental that he was able to obtain with his fixed income. So I know that was I was talking at you a lot really fast, and we are at time. I do see that. There's a question. Aiko, I see you message me. Definitely reach out for a presentation. I'll send you my email now. And I apologize for the high speed this is, but hopefully it captured some of your attention.
Well, the high speed was because we had so many amazing people and we wanted everybody just to get a touch. I realized that it's a lot of pressure on presenters to also make a presentation in 10 minutes. If it makes you feel any better, I'm actually picking my cuticles, watching the time also. But thank you so much, Alexandra. The flyer is in the chat and Darcy has the flyer and she'll be forwarding that on with everyone else's materials to the whole group. Darcy, I'm going to pass it to you. I know time is really of the essence. Would you like to open it up to more general questions, or shall we move the meeting on to the next agenda item?
Well, if there are any quick questions, we can do that. Please put those in the chat. We can address that. We also were going to have Helping Hands Senior Foundation, which is one of the coalition's partners. And our beloved Victoria was on vacation and didn't get the emails. And so this has surprised us that there's so many resources for seniors that I believe we are going to do a part 2 of this. It's not going to be next month because the homeless initiative was already scheduled, but we will let you know about that and we'll have Helping Hands participate. But we just need to hear more information. This is great resources. And, thank you guys all for being so willing to speed up your presentations and try to encapsulate the amazing things that you do all the time into such a short period of time. So were there any questions, Jean, that came to the top of your inbox there?
Checking now.
can I just encourage all of these agencies? I know that time is out, but if you have any flyers or the links to your websites, to send them to Darcy, because I was trying to write it all down and then send it to staff as y'all were speaking. And we do struggle because we feel like there's nothing out there, but now it's like we know who to call. So if you have links, flyers, anything, because PATH is in multiple spas, and I'd love to be able to share all this information.
Fantastic, Haley. It's all been sent to Darcy, and Darcy's going to send it all to you.
Yep.
I know that Dr. Heides has not gotten to Darcy yet because it came secured and we couldn't figure out how to open it, but that will soon be in there. But all but the DMH presentations are also in the chat, but it'll come to you together, collated nicely and neatly very soon.
Wonderful. Wonderful. Well, I'm going to turn it over to Haley. We always try to do a staff check-in, a wellness check-in for staff. Keep it very, very brief. And we also launch a poll. So Haley, go for it. And I'll launch the poll while people are talking.
So those that are staying, I appreciate it. I know that meetings are so tight now. I don't know about y'all, it's like you have like 2 minutes in between each meeting. So if you're still on, I truly appreciate it. One of the things that has been very popular is something called, well, it's not popular, but it's coming to everyone's effect or attention, is the word languishing. And languishing isn't a diagnosis. It is a series of emotions, right? And I had a PowerPoint, but there's not enough time. So when you feel bleh or or even that kind of consistent dread that I think all of us feel with this pandemic and the social issues that are going on, and you can't quite get motivated, right? And I think that we all thought, oh, we're working from home. And then maybe 2 months in, we're like, we're working from home. And now we're a year in and we're still working from home, you know? And I think some of us are lucky and we can go into the office, but some still can't. And now what we're dealing with is the vaccinations are being mandated, and some of our agencies are struggling with that. It's hard when you are forcing staff, forcing participants, and the word force is not a part of our normal vocabulary. We are all about choice, and we are all about taking time to see what's going on in people's lives. And we're put into a position now that we can't do that, unfortunately, because of higher everything, right? And that affects us. Yes, it affects our participants, but it affects us. If you have colleagues, you have to kind of keep your mouth shut, right? If you have supervisors, supervisees, it's a very strange time period, and that leads to weight. It's weight on us, and that's what languishing is. And I just wanted to kind of check in with the survey, because we all keep saying when COVID's over. I don't think it's going to be over. I think it's here to stay. And so we do need to talk about what that means. Are we going to talk about it like the flu, right? As in, it's just something that we have to be careful of. Are masks a part of our wardrobe now? It's not going to pass. And so how do we figure out a way to lift part of that off of us? And one, it's awareness. You have to get in touch with yourself. And we've talked about that so many times. Mindfulness is your personal way. However you choose to do mindfulness, you need to get in touch with yourself to figure out if you are languishing. Because you do, it's a beautiful hole to be stuck in, to be honest, because you're dead weight and you don't have to do anything. But there is a helplessness there when you feel like you can't get out of that, because it's not necessarily a choice at some point. So watch your body, watch who you are, watch if you're canceling events. Events are rare, but when you do get to go out, are you backing out from them? Are you in a constant fear because of the pandemic and COVID? You need to address that as well. Again, this is not diagnosable. This is just our series of emotions. It has been a year that is languishing, going on into 2, you know, and I think my best gauge is when I talk to my 9-year-old niece, and she's languishing, poor thing, you know, and so I just know that we are too. The other thing that I really liked for an intervention is to find an activity and get lost in it. And I think that is such good advice because we do forget to do it. Crossword puzzles. My mom can get into a haze with her Sudoku and it makes me laugh, but that's her escape, right? Games outside, games with children, something where you kind of forget and you're lost in the silliness or the importance of that individual activity. There's 2 TED Talks that I think just go to TED Talks or Google TED Talks languishing. And what we did at our office was we watched them together, we paused in the middle, and then we kind of spoke about it. You know, diagnoses become trendy, and this is not a diagnosis. This is something for us to check in with ourselves and our staff. It's very, very important. Again, I had a PowerPoint, and I wish we could have had helping hands talk instead of me, but we're going to always, I'm going to make sure that Darcy has those links as well. But I do encourage you at your next team meeting, whoever your team is, to actually Google languishing TED Talk and watch it and talk to each other about it, because lots of us are feeling bleh and we don't know what to call it. And that's what it is. It's languishing. And I just looking at Julie Kirk, we were even brainstorming because one of the committees that we're on, we're languishing because we didn't know what to do during COVID, right? And so we're great, smart people sitting in a room staring at each other because we don't know what to do. So it's not just yourselves, it's also who you're surrounded with. So it's just good to call it what it is and spread the awareness. Again, I appreciate all of you staying later than normal and answering the poll, because those are really helpful for us to figure out and gauge this community so that we can move forward with interventions and support. That's it.
Awesome. Awesome. Thank you so much, Haley. Always so inspiring and so good to bring us back to being grounded. So thank you. And thank you to everybody. Please, please, please put your information in the chat so that we can get to know you. And, you know, it's just so important that we network together. That's, you know, that's where our strength is knowing each other, knowing these resources, knowing all of these things is so, so key. So thank you all. I really appreciate your time. And, you know, we'll be here to chat a little bit if you're still hanging out. Thank you. Have a great day.
Thank you, everyone.
Thank you, Darcy.